On February 4th, marking the World Cancer Day, the government of Nepal is kicking off an HPV vaccination campaign for girls studying in the grade 6 to 10 and for those out of school between the ages of 10 to 14. The vaccine campaign will take place for 2 weeks and across the country. Now, what is HPV? How does it affect girls, and why is the government of Nepal aiming to vaccinate more than 1.6 million girls of school-going age? That and more in today's Kantipur News Talk. Please join me in welcoming Dr. Vivek Lal, Chief of the Family Welfare Division. Dr. Lal, welcome to Kantipur News Talk.
Thank you for having me on this show.
You must be very busy with all the preparations for the vaccination campaign.
Yes, we are.
How is it going? How is it going to roll out? How do you plan to vaccinate so many girls? 1.6 million, is it correct?
Yes, approximately 1.68 million girls. And as you understand, these are massive undertakings and you cannot do them overnight. So things have been going on for more than a year. It took us 3 years of lobbying before Nepal could secure this vaccine, which is highly sought. There is a scarcity in the global market and every country is vying to secure as many doses as possible. So we are very fortunate compared to some of our neighboring countries who have been trying for 10 years or more. And we are one of the very few fortunate countries in Southeast Asia region who have been able to secure it for all our target population. As you rightly said, those girls who are in the grade 6 to 10 and those out of school is 10 to 14.
How do you roll out the vaccines? For example, there are so many remote regions that are not accessible. How do girls in those regions?
The way it is done is that first we plan at a national level. We get all the data on how many girls are there in the school of the target group and how many girls are not going to school in that target age group. And we interact with all our stakeholders, including the education sector, the local municipal governments, health workers. And based on that data, we start our planning. And the vaccines have been procured based on that planning. But when it comes to immunizing those target girls, it is all done by the municipal governments. They have the best knowledge of where those girls are in the school and where those who are not going to school can be found. So they do what we call a micro planning. And they come up with all these dates. They identify which schools to go to first. So if anybody would like to know when the vaccination is going to happen, in which school, on which dates, I would always request them to reach out to their municipal health officials or to the nearest schools, because then they would know when it's going to happen. Another is the massive cadre of female community health volunteers that we have in each ward and municipality throughout the country. So they would be the best people to tell you when and where you can go and get this vaccine.
You said it took 3 years of lobbying to get the vaccines locked.
Yes.
What do you mean by that?
So the thing is that it has been proven for a very long time that there is a very effective and safe vaccine available against cervical cancer. And most of the well-to-do nations, high-income countries, they have started rolling out these vaccines since 2004. So, and there was very limited production throughout the country. There were very few manufacturers as well. But with time, there have been new manufacturers which have been certified. And so the supply has eased up a bit, but still it is nowhere near the global demand. There is a global commitment spearheaded by WHO on eliminating cervical cancer as a public health problem by 2030. So we are already in 2025. And one of the 3 major pillars of achieving that elimination goal is to immunize our girls before they reach their age of sexual contact. And so the most effective age for immunization has been identified as 9 to 14 or under 15 years. So that's what we're aiming for.
Talking about the price of the vaccine itself again. How much has the government of Nepal invested this time around for it? Is it solely from Gavi? How much share are we, the burden are we taking ourselves?
So I'll tell you that when Gavi agrees to the government's request, they enter into agreement where we call co-financing. So the government, based on its own gross national income, its ability to invest, has to pay a certain amount. And there are different national income brackets. So based on our country income. For example, we are able to procure this vaccine at $3.2 per dose. Okay, but for those countries which are much better off than us, they might have to pay more. And every year, government will have to pay an additional amount, so that every year the country's responsibility and burden for that vaccine goes on and on. So it's a gradual increase, so that country can manage its resources. It does not have a direct one-time impact on the national resources. So that's how it would be. But if you were to buy the same vaccine in Kathmandu in open market as well, it will cost you anything but above 605,000 rupees. So you can understand the price difference here.
That also brings into question the accessibility for those who are not between the age gap that the government is targeting right now.
Yes.
Say, for example, a woman of my age.
Yes.
Right? How do we make it more accessible, affordable?
Okay, so rest assured that when government wants to come up with any initiative in public health, it does not want to exclude any age group. We are targeting the age group that globally has been proven to be the most appropriate age for introducing the vaccine, because after a certain age, its importance goes down. And
Effectiveness.
then if more than effectiveness, like what happens is that there are global studies, and based on that, WHO has recommended that the adolescent girls below the age of 15 are the best age group to provide this. And that's why Gavi also has provided us the vaccine for that age group. And for those who are already who have already crossed that age group, we have other programs where we do free screening of the woman starting age 30 to see if they have any infections or not. We have very effective tools to do so. And it's not just one time. If a woman tests positive for HPV virus, it does not mean the end of the story. There are still chances that the virus might disappear on its own, because the body's immunity also sometimes fights off. But we do not rest on the immunity. We, after every certain age interval, request the woman to come again for a free screening checkup. And based on that, we follow her up. So it's not that, okay, if I'm already beyond that age, I am doomed, I'll no longer be protected from cervical cancer. That's not it. So I'll go a bit back and talk about the cervical cancer global elimination initiative. So there are three pillars. One is the immunization. The other that we have not talked much about, but Nepal has been doing since 2010, which is screening for cervical cancer in apparently healthy women starting age 30. We do that across the country as a annual kind of an event, so that if there is any issues, we can catch them early. There are treatment modalities available nowadays where it can be done in a very basic health facility by trained nurses itself. So if in early stages, if anybody unfortunately comes with what you call precancerous lesions, we can treat them. And as I told you, we also periodically follow them. So rest assured, it is not the end of the story. There are ways through which we will ensure that we are able to touch upon all three pillars. One is immunization to protect. Second is early screening to early detect. Third is early and effective treatment. So the government is working on all three prongs at the same time.
This screening you talked about for especially women above the age of 30?
Yes.
How often do they have to get the screening?
Okay, so we have now two methods of screening. I would not like to bore you with the details, but based on that, based on the method of screening, there are two, what we call, one is visual inspection with acetic acid, or VIA for short. When you do with that method, we invite the woman to come again after 3 years. And another is a method based on PCR. Now everybody after COVID knows PCR, which is even more effective method, and government is trying to roll that out throughout the country gradually. And therein, the woman has to visit only every 5 years. And I'd like to tell you that we are more proactive than what WHO recommends. WHO says it's fine if a woman comes in after every 10 years, but we are being more proactive and trying to make sure that we do not miss any cases. So we are inviting them to come in after every 5 years.
Say, for example, any female audience is watching and she wants to get the screening done.
Yes.
How much of an investment would it take for her?
If it is through the government sector, none, because it is provided free of cost. It is just that she needs to contact the nearest government health facility.
Okay.
And they will be able to tell her when it is being done. It's also available in private, and there are many public level hospitals where it is done in a routine manner. So based on the type of facility that you go to, the cost might vary. But when the government does it through its own routine program, it's absolutely free. Even the treatment part is taken care of.
Has it been a challenge to manage the crowd if it is free?
It is, because as we understand, now people are more conscious about their health status. And mind you, the cervical cancer burden is huge one in Nepal. It is the second most common cancer in women and the #1 cancer that kills women. So, and as we have talked more about it, more screening being done, people are more aware. So I think it's going to be a challenging task for us, but something that government has already committed on a global scale that we will address. So hopefully in the days to come, we'll be able to find adequate resources domestically as well as internationally to meet our 2030 elimination goals.
So when we talk about HPV, human papillomavirus, it is just one kind of infection? How does it turn out in a person if they contract it?
Okay, so fortunately, why I'm saying fortunately, because you know cancers can have multiple causes. And it's very difficult to pinpoint one cause. Sometimes you say genetics, sometimes you say environmental factors, sometimes chemicals, foods, whatnot. But when it comes to the cancer of cervix of uterus in a woman, we know that almost all the cancers are caused by a virus called human papillomavirus. So that is the initial point from which it has become a possible task. And when you have a virus, we have now very effective vaccines against that, you know. So that is something that has helped us kind of come up with a strategy to have this elimination by 2030. So this is how we are able to kind of, let's say, look at it from a public health achievable task. Otherwise, there are so many other things where there are other cancers where we are only talking about controlling, about reducing the burden. But here we are confident that we will be able to, after a certain age, when these girls who are being immunized now reaches a certain stage, they will be totally immune from this virus and the cancer. So what happens is that once this virus enters your body, which is usually through sexual contacts, in many of the cases the vaccines, the virus might be washed out or might remain very dormant because your immune system fights to keep it that way. But any time during your lifetime, it can again pop up, it can become virulent, it can cause cancer. So you can never remain certain about it. That's why we have these routine screening at a periodic intervals. But let's say if it enters a woman at the age of 20 after sexual contact, then majority of cases it disappears itself. And it takes more than 10 years, sometimes 15 to 20 years before that virus causes cancer. So that's why we do not screen women between 15 to 30. We start screening 30. But as I told you, like there is even longer period during which the virus may not show up. But we are being more cautious, more proactive, and we start screening before the virus has any chance to do any damage and cause cancer.
What about the male population? Are they only carriers, or do they also feel the effect of it?
That's a very important question. Males also suffer from the effects of HPV. It causes cancers of, let's say, tonsils. It can cause cancers in other parts, but the majority of brunt is borne by the woman. And that's why the vaccination is primarily targeted for the woman, for the adolescent girls. And what happens is that if you, the WHO studies show that if you have more than 80% of the adolescent girls covered by this vaccine, then the automatically protection is passed on to male as well. And as I told you earlier, the vaccine is highly sought after. There is a huge global scarcity. In some of the well-off countries, they immunize boys as well. But if I had a limited resource, then I prioritize it for the those who are the biggest victims. And when you vaccinate the girls, the the protection automatically passes on to the boys or the males as well. So that's why the strategy is to focus primarily on these adolescent girls.
There are many myths as well concerned with the HPV vaccines. How do we break it? How do we break many misinformation that's available easily on the internet as well?
Yes. So I believe that is one of the undesired effects of access to the social media. Why I'm saying so is because nowadays we see so many things across our timelines on different social media, but we hardly have time to fact check. So my request would be that if anything comes whenever you are browsing any social media or internet, make sure that the source is an authoritative one. When I say authoritative one, make sure that it is from organizations which are globally renowned, such as World Health Organization. You can reach out to the Center for Disease Control in US and such, or you can rely on the National Immunization Program. We have our websites, we have our Facebook and other media, or if you want to know more about it, reach out to the health worker, the doctor in the nearest health facility that is there. Or we also have a toll-free helpline number. It's called Hello Health. The number is 1115. So if you have any queries, feel free to dial in, and our colleagues will be more than happy to reach out to you with the answers.
Now, coming back to the vaccination campaign, that is to kick off from tomorrow, February 4th.
Yes.
Those who are getting the vaccines, or the girls' parents and guardians, how can they be assured that the vaccine is going to be proper? Because there might be concerns, right? Okay,
so I'll tell you, our immunization program is unique in the sense that we have had decades of investment in this program, and the quality controls are one of the best in the world. Well, I am emphasizing best in the world because as a common citizen, I can understand we do not have a lot of trust in terms of the government services, the quality of the services, the safety. But immunization program over the years has proven that it delivers on the promises. Look at some of the diseases that we heard in the past, but they are no longer part of our public health problem. A lot of people might just have heard of smallpox. Nobody sees any people with smallpox. You do not see a case of polio nowadays. You do not see a case of diphtheria. You do not see a case of whooping cough or tetanus. These people take it for granted. But let's not forget that it took us a lot of effort in terms of resources as well as energy in terms of providing immunization to all our target population. And that's how we have been able to eliminate many of the diseases, eradicate some from the globe itself. So immunization program has been able to do so because of the investment that has been made. And when it comes to quality control, they are not just tested locally. Globally, there are parameters and standards which we have to meet. When it comes to the vaccines that the National Immunization Program provides, they are all WHO pre-qualified. When I say WHO pre-qualified, rest assured that there are no better measures to ensure the safety and quality of vaccines. And all the vaccines that are provided through immunization program, including the HPV vaccine, are WHO pre-qualified. And not just the manufacturing, all the journey that a vaccine takes from manufacturer till reaching your arm, it is quality ensured. What we have is a chain of cold chain equipments from the time it is manufactured till the time it is provided to the target population. All the equipments, the temperatures, everything are very stringently controlled. So all I can offer is my what should I say, request that please be assured about the quality of the vaccine, safety of the vaccine, and the effectiveness of the vaccines. It's not just anybody else, it's you, me, our families, our relatives, everybody in this country is getting this vaccine of the target age group. So it is not, and government is providing it free of cost. It is not a commercial venture. There are no hidden interests for the government. It is just to improve the quality of life of the people and prevent them from a preventable disease which has catastrophic consequence when one contracts it.
What about any possible potential adverse effects? What can be seen? What can the girls experience after getting the vaccine, and how do we deal with it?
Thank you. That's a very important concern that a lot of parents have raised with us. As with any other medicine or vaccines, we do anticipate there would be sometimes some adverse events, and that's why we are all prepared for that. A lot of the girls who would be getting this vaccine would remember very well getting their COVID-19 jabs, and you know, this is provided through an injection. So obviously injections do prick, and there are minor issues. So sometimes you'd feel slight pain, sometimes you'll feel slight headache, sometimes you'll feel a bit nauseated. So those we assume as minor adverse events, but sometimes among millions there might be one or two what we call serious adverse events, and for that we have got teams of medical personnel who have been trained from the time that you receive vaccination till the hospital. So if there are any, the health worker there is well trained to handle that, and those information also comes to us at a very high level. We are one of the very few countries we have a separate immunization act to address that. We have got a national adverse event following immunization investigation committee manned by experts, and they look into each of these, and our act mandates that if anybody suffers any serious adverse events due to vaccines, if they are proven to be caused by vaccine, then their treatment is also reimbursed, and they are also what should I say, open to further kind of medical services and consultations as well. So rest assured, all those would be managed. We are well prepared for that, but as with any other vaccine, minor adverse events are to be anticipated, that I had just stated. So and they usually kind of subside over the time, over a few hours, and we also request all the girls who are going to get this vaccine that please stay for half an hour after the vaccine at the vaccination site, be it your school or health facility, so that the health worker there gets a chance to observe you, and if there are any issues they can immediately address that.
Not to exaggerate on it, but what if it lingers? How long would one have to observe themselves before seeking for medical help?
So if you have any issues which you feel that no, I am feeling very sick or I need a medical attention, do not hesitate. Reach out to the health worker who is providing you the vaccine, or after you go home, if you have anything, immediately seek medical consultation at the nearest health facility, and also let your teachers or the health workers know, so that those are immediately brought to the attention of the higher authorities, and we'll do our best to attend those.
You mentioned something about reimbursement. What does it include? So
the Act says that as per the gravity of the situation, if let's say somebody needs a prolonged hospitalization for some unfortunate adverse event, then those treatment costs are to be borne. But fortunately, I'll tell you the example with this vaccine. Last year, government procured 20,000 doses of this vaccine through our own resources, no Gavi support. We vaccinated almost 10,000 girls. There was no serious adverse event. So though we are prepared for the worst, we are very confident that we will not have any, and if there are, the medical teams are all trained, all ready to do so.
What is the next phase that the government is planning?
Yes, that is an important question. So this year we are trying to catch up the entire target population, that is below 15 years. Next year onwards, it would be provided to the girls who are studying in the grade 6, or for those who are unfortunately not going to school, girls is 10, and they would be provided primarily through the school-based vaccination program, and for those who missed that, we'd have outreach sessions as well as immunizations provided at the health facilities. So it will be, as I told you, a routine immunization program henceforth.
Well, Dr. La, thank you so much for your time, and we wish you all the best with the campaign.
Thank you so very much, and we'll need all the best wishes and support that we can get. Thank you so much for having me today.
Thank you. Cervical cancer is the second most common cancer in the developing world and a major cause of death among Nepali women, but it is preventable. The government of Nepal is all prepared to get the girls vaccinated from February 4th till the 18th. Please make sure to get your girls vaccinated. Thank you so much for joining us here on Kantipur News Talk. That's all for the moment. Bye for now.